Good evening, everyone. Thank you for joining us tonight. We're having a discussion with California Senator Aisha Wahab about politics and health equity. And this is a professional webinar being sponsored by the School of Public Health at Berkeley Alumni Board. Next slide. So the Alumni Board was established in 1953, and it's led by a volunteer board of directors, and it includes several standing committees, including scholarship, diversity, inclusion, events and networking, and professional development. Next slide. So tonight, there'll be a Q&A at the end of the presentations. Just please type any questions into the Q&A box. You are muted by default, and this webinar is being recorded. Next slide. So I want to acknowledge Eileen Pearl, the Director of Annual Giving and Alumni Relations, and then the Professional Development Committee with Tanya Bustamante, Shweta Churamani, Alice Chu, Stella Ling, myself, Nahari Patel, and Bonnie Tung. With that, I would like to introduce Senator Wahab. I've known her for quite a long time now. We actually met at the Afghan Coalition in Fremont many years ago. Anyway, she was elected to the 10th district in California, and it includes the cities of Hayward, Fremont, Union City, San Jose, Santa Clara, and others. In 2018, she had a seat on the Hayward City Council. She is the first Afghan-American woman in the U.S. to be elected to public office. She has served in many roles over the years. And currently, she serves on 7 chairs in the California legislature, including safety, health, housing, and human services. I have found her to be a very powerful voice over the years for the underserved people in our population. So, Senator, welcome.
Thank you. Thank you for having me, Dr. Newhouse.
So we have some questions that were submitted by the board members. And the first question I'm going to ask you is, what are your thoughts on the intersection of politics and healthcare equity?
Definitely. Well, first and foremost, I do just want to highlight that equity itself is considered a political issue, right? And should we prioritize equity or equality or, all the arguments that people want to have? But providing healthcare to vulnerable populations is also a political issue that, genuinely, when we're talking about society as a whole, anything that happens becomes political. So whether we're talking about women's rights, whether we're talking about childcare, whether we're talking about dental implants, whatever the case may be, it's all politics, and it's all stems to money and funding. And we have to highlight, what are we going to prioritize as a community? What are we going to prioritize as a society? And I think it's incredibly important to understand that the needs of the community really depend on the influence in politics, right? And so being involved, having a voice, meeting with folks, educating folks with problems too, especially in the medical field, prioritizing a patient's care should be first and foremost above anything. And at the same time, how can you explain that to an elected official who may not be a doctor? There's very few medical doctors in the field. We had one, and we have one right now in the assembly, but none in the Senate. So it's just, really thinking about those issues and how you can educate. But equity is incredibly important because you are protecting the most vulnerable.
So how do you define public health? And what are your current public health priorities?
Definitely. Public health is about, to me, how we protect, improve, promote, research, and educate individuals and communities at large on issues that are related to health and prolonging life. But more importantly for me, I care about the dignity of and quality of life. But, again, I don't necessarily have a healthcare background, but we all have family members that age. We all have family members that end up being sick or have some issue or concern. And, you know, we learn through our own experiences. And I think the immigrant community in particular is probably one of the most vulnerable communities, because healthcare is not really thought about as a priority. It's food and shelter and so forth. So, you know, for me, I have a number of bills that really pertain to mental health first. But I do want to talk about my number one priority bill for this year is called the SMILE Act. It's SB 980. It basically requires all like Medi-Cal recipients to be able to get a dental implant, which is not the case today. And the department, DHCS, has, you know, in a number of meetings, they say that it is included, but the threshold to qualify for a dental implant is basically cancer of the jaw, right? It's something egregious. And 1/3 of Californians actually are on Medi-Cal. And to be on Medi-Cal, you have to qualify at like 120% of the poverty level. So these are some of the poorest of the poor. And the fact that they don't get a dental implant is quite shocking. I have a couple of nursing facilities, payment source discrimination, very much focused on the aging population, as well as, you know, recipients of IHSS. I want them to be able to renew their applications every 3 years, not every single year. It tends to be a burden for those that are very ill. And then the mental health bills in particular that I'm very much interested in is SB 1320, which basically establishes health plans to have a process to reimburse providers for mental health, and a child suicide prevention, which kind of relates to just ensuring that if there is a mental health crisis, that a qualified behavioral health professional is the first point of contact. And SB 402, a 5150 bill that expands who can, you know, issue the 5150 and initiate that. So right now it's police and I believe psychologists, psychiatrists, I should say. What we need to do, and my bill basically expands it to licensed marriage and family therapists, licensed clinical social workers, and 1 or 2 other fields for those people that are actually trained that should be calling the shots on, you know, who should be 5150. So I have actually a lot on healthcare, and I didn't realize that until I actually spoke about it right now.
I think you brought up a really good point about the issues of dental care. I don't think people realize what an impact not having dental care is on not just overall health, but even on things like just being able to get a job, things like that, and your quality of life. So I'm really excited to hear that that's something you're really looking into, and especially about the issues around mental health. And speaking about mental health, what were the driving factors that led you to author SB 402? And for those who may not know what that is, it's a bill that could have people who are having a mental crisis be committed for up to 72 hours. So if you'd like to talk a little bit more about that bill and how it came about.
Definitely. You know, I was a board member of the Afghan Coalition for a number of years. Dr. Newhouse, this is how we met. And the Afghan Coalition is a nonprofit and really benefited from the Prop 63, which provided community-based organizations to provide prevention, early intervention for their communities, you know, hiring people that look like them, speak the same language, and so much more. What ended up happening is that and I don't see the data just because, again, our data systems in the medical field are also limited. But I do feel that the new arrivals amongst Afghan refugees and asylum seekers and so forth seem to have a higher propensity for a lot of mental health issues, whether that's PTSD, certain types of trauma, depression, bipolar, as well as schizophrenia, right? And there was, you know, a number of different things that I've seen just within my own community and how difficult it is to get somebody the help they need, even though the family wants to help as well. But let's say the grown adult is unwilling to believe that they need help. And clearly all signs are indicating that. And then on city council, when we would have mental health calls and homeless calls, police are dispatched. And police, you know, if you pay attention to the news in the last couple weeks alone, there have been a number of individuals that have mental health problems where police have ended their life because they did not de-escalate. So it was in a lot of my police reforms, and I'm chair of public safety right now in the Senate. I really wanted to tackle this issue, and the law really only allows for 5150s to be initiated, which is a 72-hour hold by law enforcement and I believe psychiatrists. And I wanted to expand it to those that are actually have a background in mental health and have a background in healthcare and are licensed by the state to do this work. So it makes sense, and we did it, and we've also had a lot of pushback, and because they don't want people institutionalized, and this is not pure institutionalism. This is, you know, a 72-hour hold to see whether or not meds need to be adjusted, whether or not this person needs more care, less care, whether they're perfectly fine, and much more. And I think that that's a reasonable thing, and it's also something families sometimes request. So that's why I did it. A lot of my bills, to be completely frank, are author initiated. So it's not a lobbying group that comes up to me and says, please carry this bill. Many of them are my own bills of what I've seen in the community.
Having had to have some patients admitted for 5150s, I can relate to how serious a situation that can be at times. So in my practice, fortunately, it didn't happen too often. What is the most surprising thing that you've learned from your constituents since you've become senator?
I think that most constituents actually want the same things. You know, we talk about housing and homelessness and better healthcare and public safety. It's the main basics. I also think that, you know, oftentimes when I talk to people, they always ask me about how Sacramento like, and I have to tell them that it's not like city council where you have a day job and then in the evenings you go and you deliberate over land use policies mostly. I said, you can tackle anything under the sun except for a lot of federal issues, but your colleagues are not just colleagues. You are stuck with them for almost 24 hours out of the day for the majority of the week. It's more like boarding school because every restaurant you go to is either a lobbyist or a colleague. You go to the bathroom, you know, you go, you know, in meetings, you walk in the hallway. So, and many of us actually live in buildings next door to each other, if not apartments next door to each other. So, it's not like a normal job where you can like just go home and decompress. You're literally with them 24/7. So those are some of the things that I think my constituents learn about this. And then we try to work with our constituents a lot. They sometimes need a lot more help with EDD services, a lot of state services, DMV, and much more. And I often learn about what are the pressing issues. So for example, the public utilities is the #1 concern right now for many people. And we try to prioritize that. You know, a lot of people were concerned about Boeing. Granted, it's the FAA that really deals with, you know, the air, but, you know, we try to do our best and write a letter and say that we're concerned about this or that. So I think that they're genuinely surprised at how easy it is to communicate with my office in particular. But then also I get to learn about some of their more pressing needs that maybe aren't as highlighted immediately until they make a complaint of some sort.
So do they mostly meet with you up in Sacramento, or do you meet with them in Fremont and Hayward and things like that as well?
I meet with them on weekends. I'm usually in the district, but there are often times that I use Zoom a lot, just to meet with them pretty quickly, and you know they get to get whatever off their chest and advocate they want to the way they want to. I can also not have to delay a meeting or conversation, so I'm pretty accessible. My staff is also not politicos. Some of my staff, Nergis, who you know, she's a licensed marriage and family therapist. We have others that are substance abuse counselors, others that are teachers. So very much in the community service, community-oriented space. So they're very accessible to the public as well.
Great. So what role do you see for technology playing in advancing public health goals?
Definitely. Right now there's about 40 artificial intelligence bills in the legislature. So we're going to see what happens. I think oftentimes, and I worked in tech, policy doesn't catch up to technology fast enough. And it's largely because there's no real tech person in the state legislature. And at the same time, I hate to say it, the state legislature still functions, especially the Senate, on paper. Everything is paper. It's very old school. And the Secretary of the Senate stated that just a couple of years ago, she did a survey. The majority of the folks are a little bit older and prefer not to use technology. This year is the first year, and I was very adamant last year that, we have some iPads and, stop wasting paper, and we can do control find when we're looking for a note that we wrote. And so I think that's incredibly important. But in regards to how it would help with, health as a whole, I think that telehealth is incredibly important, but there are people that push back against that because doctors today, the arguments so far that I've been hearing is that they don't want out-of-state doctors to be able to, utilize telehealth and provide services, usually cheaper. Often their licenses don't necessarily match up with everything in California when we're talking about the different professions and scope of work. I also think that there's, precision medicine with like DNA analysis for medication compatibility. And yet, some of the risks are what we always are worried about is privacy, especially with DNA testing and being able to check, if you're going to be more susceptible to this. I care more about how insurance companies use technology more so than research and how doctors and nurses and so forth use technology.
So are there some specific initiatives in place to leverage innovation for improved healthcare that you know of?
Yeah, there's a number of different factors. We often talk about with pharmaceutical companies, and their technology is eye-opening. And granted, the technologies that they have, and of course it's for sale, and they usually sell it first to a lot of the UC Davis, Stanford, so forth. But they can pinpoint exactly where cancerous cells are and literally just provide chemo treatment to those specific cells without doing the full radiation of like larger positions on the body. That has been fascinating to watch. I think that the movement to research, the amount of research, when they talk about pharma and big pharma, just for research alone, to be qualify as big pharma, you have to have over $250 million a year just in research to qualify as one of the big pharma companies. $250 million a year is a lot of money, right? And it's for, one specific department. So that's interesting. But again, it's always about technology with how's it going to be utilized? How do we ensure that it's no bias in it? How do we ensure privacy is maintained and much more? So there's a lot of positives in regards to treating a patient, but there's also a lot of negatives, in my personal opinion, in regards to insurance and how people will pay for things and much more.
Yeah, and you're right. Bias is a huge issue because we find so much bias in the field of medicine and data collection and how patients are treated and everything else. In light of recent public health challenges, such as the ongoing pandemic, how do you envision the role of the state legislation in preparing, responding to future health crises? I mean, I think COVID really tested the systems in the state and across the country, of course.
I was on city council when COVID first came about, and there was a number of things that I was like very frustrated with. Most city councils, including my mayor, she wanted to step aside and let the city manager take care of everything. And yet nobody dealt with a pandemic such as COVID. And so it wasn't, in my mind, it wasn't wise just to let somebody who also doesn't know what they're doing to lead, right? So I have been disappointed in some of the responses in regards to how we handle pandemics from a political / policymaking role. And the business has to continue. There are state laws and mandates that, we have to pass a budget, we have to do X, Y, and Z. And we also want the public input, regardless of, what's happening. And a lot of local cities cannot or did not know how to have Zoom, available to the public to participate and much more. And I think, in regards to technology and just public policy, I think, having Zoom and access to anybody just being able to cook from home but still partake in a public meeting is incredibly important, especially during a pandemic where, you don't want germs to keep touching each other and so forth. But the other issue, I think one of the biggest issues is we clearly saw even our hospitals weren't even equipped for this, right? Whether we're talking about PPE, whether we're talking about, how do we protect staff and at the same time protect, patients, how many beds we have. Like considering we're the fourth largest economy in the world, that most electeds love saying, we did a very poor job in regards to handling COVID early on. And I say this, even though I know that we had a lot of benefits. The city of Hayward, for example, our firefighters set up the first in the nation testing clinic, right? And we also had one of the first vaccine clinics and so forth. But the problem that I saw was there was such a reliance on technology that we forget that there are certain communities that don't have access to the internet. So how do they even sign up for a COVID shot? How do they even sign up to get this access, right? We also know that not everybody has health insurance. Not everybody is physically able to go and get, these shots or these tests and so forth. So there was a complete lack of regard to the most vulnerable communities. And even in Alameda County, more specifically, they set up, the county set up a massive COVID testing site in the Coliseum and much more eventually. And our fire chief reached out to me saying that there are certain communities that their testing rates are lower than anybody, specifically the Asian community at the time. And he said, how do we reach out to them? The reality is that there are communities, largely disenfranchised communities, that don't have relationships as much or as closely as your churches per se, right? There's 5 mosques in Hayward, and the city didn't really have a very strong relationship with them. The Chinese community groups didn't necessarily have a strong relationship in every city with their, city council members and electeds. So I think that there was a lot there, but I think housing is also incredibly important. How we provide safe and stable housing and ensure that people don't lose their homes because, they can't go to work or they're mandated to stay at home. How do we ensure that there's dignified space for quarantines if called? How do we protect our homeless population? And I will say the state of California in the last year to 2 years purchased all the Motel 6s to be able to house, our unhoused population. So there's a lot of things that we learned, and I think that, we can be very resilient. But I also think that this tested every boundary of local government, law enforcement, as well as state government and policies. So we have a lot of work to do there.
Yeah. And this is the School of Public Health. And of course, with the misinformation on the internet during COVID and things like that, even becoming in certain areas of the country, just being in public health has become a risky job.
Yes.
Threats and things like that and misinformation. And anyway, it's another topic. So more information about Senate Bill 555, and this is the Stable Housing Act that you were one of the sponsors on. Who will be eligible and what are the criteria?
Definitely. So SB 555 is the first social housing bill to ever be signed into law in the nation. And I'm very proud of authoring that particular bill. It's not that anybody's necessarily eligible this way or that way. It prioritizes that HCD, the Housing Community Development Department, creates a study and a bill that has specific timelines for the study to be completed no later than December 31st, 2026. And specifically, it prioritizes lower income families, seniors, veterans, foster youth, and people with disabilities. And so from, like, let's say low and extremely low incomes, to be able to have housing, but also not only to create housing, but to maintain affordable housing today. In the state right now, majority of the conversation is all about development, development, development. We have seen a significant amount of development, but it's not necessarily affordable, because most cities, and I say this all the time, and cities get very upset with me, they have a conflict of interest in the fact that they rely on property taxes. The higher the cost of the home, the better the property tax return is for that particular city. So they're not necessarily truly interested in creating affordable housing. And social housing allows for government to create housing, but also nonprofits, co-ops, investors, whatever the case may be, but any type of deal that can be made, it's deed restricted, so that housing will always be considered affordable. And it allows for tenants to have a right and a say in, a lot of different things, so they are not unfairly evicted and much more. So social housing and the Stable Affordable Housing Act, which is SB 555, is not a new concept. It's actually been tried and true throughout the world, in places like Chile, Vienna, Singapore, and many other countries, more specifically with different levels of government, different economic systems, and much more. And it works because housing is the one stabilizer of all families. So I'm very proud of that. I'm looking forward to seeing what happens with that, study and some of the responses and so forth. So I'm very proud of that particular bill.
There's a couple other parts of that question is, where would the housing be constructed? And maybe you already answered it. And how would the units be triaged on need?
Definitely. So we're assessing a lot of those protocols right now. We take a look at, again, if you're low income or extremely low income. So that is going to be pretty standard. But the beauty of social housing is it could be on a hill, it could be in the middle of the city, it could be anywhere. And the reality is that's what we're trying to prioritize with social housing. People often ask, what's the difference between social housing and public housing? Public housing was primarily for the lowest, income individuals, right? So you knew you had to be poor to qualify, right? And it had a stigma attached to it. It was built with the least amount of dignity consideration for quality of life for an individual, right? It was built in undesirable locations, and it was primarily fully funded by government subsidies, right? Or government funding, right? With no dignity to the resident for evictions or anything like that. Social housing allows for funding to be pretty much from anybody and everybody. It's deed restricted. There's certain laws that the tenants have rights to, again, not being unfairly evicted and much more. It's not only just like rental housing, it's also home ownership, right? So it's a broad, scheme of things. And it could be built anywhere in a city or a neighborhood or a county or so forth. So it's a little bit broader. It's a modern take, if you will, but also has a priority focus on dignity.
Great. So how will you collaborate with local health departments and community organizations to implement public health initiatives effectively, such as SB 555, considering the diverse needs across the state?
Yeah, I have colleagues that represent rural areas. And so they always talk about agriculture and how many cows, this and that, and, very much not the Bay Area. And so sometimes I have to rely on their understanding, expertise. And I think that, when we're talking about, advocates in Hayward, for example, relied on the public health department to support the need for a moratorium, right? On evictions. And departments were valuable resources. They provided a lot of data, a lot of information, and leveraging organizations that work across the state. For example, the County Health Executives Association of California, Health Access Now, California Pan-Ethnic Health Network. There's a number of different organizations and agencies that are advocates, first and foremost, to ensure that, the best is done. And then also just educating those stakeholders in these local health departments and much more. I think it's the same thing that I say often. It's the communication. It's making sure that, transparency is fully there, and the public can see it in real time oftentimes. And for example, Santa Clara County did a really great job of showing, I think it was one of the leads in the country, Dr. Sarah Cody did an excellent job of highlighting what is the concern. She was one of the first to talk about it. Metrics were very much public. How many cases, where are they in zip code, and much more. More so reliable than some other doctors that were on TV every day.
Okay. Do you think that the public health workers will receive the respect that was previously there before COVID, or is they still at risk as they were during COVID?
I think the problem is that the pendulum swings left and right. Right. You start to realize what's important during a crisis, who's really out there on the front lines and much more. And the sad reality is much of our society is out of sight, out of mind. And, we clearly saw that public health workers, as well as who was really very important to society, right? And it's not just status of, a doctor or nurse, but it was also when we go to the grocery store and who's helping us out there, right? Who's really exposed to community. And so it's not about how much somebody gets paid. It's not about, what position or education or title they have. It's about respect. We have to respect all people, right? And all people are part of our community. And it's incredibly important to see that. And so I think that, staff with kids who are constantly sick from school and daycare, we do need to do better across the board, right? Whether you're in a specific profession as a public health worker or you're a bagger at a grocery store, right? And so for me, I just feel like that's very important, and prioritizing, again, certain access to the public. So our senior population in Hayward, I was very adamant that, they should be able to get their groceries between 7 a.m. to about roughly 10, 11, 12 noon, right? Where it's completely designed for them. They can go one at a time, specific hours for them, and the rest of the public can go a little bit later, but, they're immune compromised, a good chunk of them. And so we need to just understand and meet people where they're at.
So there was a bill that you're looking at that was going to integrate the transit systems in the Bay Area, which I thought was a great idea, by the way. And would that help those transportation issues for people who are like in food deserts, or like you saying, trying to access medical care and things like that? I think would be helpful, but your thoughts on that?
Definitely. I think that, again, I initiated the bill because there's 27 transit agencies in the 9 Bay Area counties. And, as much as I support doing your own thing, I think it's a significant waste of money. If the service is not cheaper, faster, more secure, more reliable than driving, right? We should be competing with the individual car. And so that is to definitely consolidate transportation to really save money first and foremost, and then utilize it. The bill, the way I wrote it was to prioritize the rider's experience in regards to speed, technology, cost, and safety, as well as, ensuring that we meet our climate goals. In regards to food deserts, we have a number of problems. One, in many cities, especially so in the Bay Area, there's only so many areas that have food deserts, true food deserts, and there's a definition to it. In Hayward, I don't believe we technically had a food desert, but for example, the most local grocery store for those that live in a hill is down the hill. And that takes a good 10 plus minutes to drive to, and you'd have to drive. So if you don't drive, how do you get down a hill, right? And the bus service only goes so far. BART doesn't go up a hill, right? So we really have to think, what does our public transit look like, and much more. And so I think that we have to prioritize not necessarily transit, which of course, does improve access and the resources need to exist where people are. But I do think that when we're talking about land use issues, we should allow certain small mini marts to be up in the hills. It should be in areas that, don't necessarily have healthy access to food. So in Hayward, for example, they have historically always wanted a Trader Joe's, like a healthy food option store. And Trader Joe's never wanted to come into Hayward. And you're wondering why. It's in the heart of the Bay Area. There's a lot of schools in the area. It's decently dense, so forth. A lot of these stores don't necessarily look at the income of people. They don't even necessarily look at like how many people are in the area. They look, and this is the part that matters for when we're talking about health. They look at the education, the average educational level of a city. And Hayward actually has, sad to say, a lower level of education across the board than, let's say, a city like Fremont. And Fremont has a Whole Foods and a Trader Joe's, right? And so I was able to bring in Sprouts to Hayward, which is also a cheaper, healthier food option store. But these are things that I don't think people realize. And when you take a look, we all know when we study data that more educated individuals tend to choose healthier food options, right? Whether it's organic, whether it's, hormone free, whether it's, X, Y, and Z. Whereas people who are working and let's say have a lower educational level and are, maybe even working 2-3 jobs, they will take the beef jerky, they will take the Cheetos. They just want something in their system to continue moving on and working. And that's the sad reality of our society. And it's something that I think is incredibly important. And that has nothing to do with transit. It's just, we need better policies to ensure that all people get access to food.
Okay. So I have one more question for you, and then I'm going to see what the questions will be in the chat box. So if anybody else has any other questions, please send them into the chat box. So is there any upcoming legislation this year around the issues of healthcare equity that you're aware of?
I think there's a number. We often, I think that I've already seen a number of bills regarding primarily trans youth. I think that's a topic that a lot of people care about in the legislature. I think that there's a number of bills. I'm just going to say personally for me, my dental bill, the SMILE Act, is probably the number one most important bill in the legislature, and I'm going to be that aggressive with it. I have 24 Senate co-authors. So the senators out of the 40, 24 have co-authored, which basically means nobody should touch my bill and water it down. But we have, like I said, I've been talking to DHCS. That seems like low key opposed to the cost of it. And I asked them, how many dental implants have you guys done in the year 2023 or even 2022? And they do not have that number for me. And yet they're going to say this is a big ticket item because, we are in an economic downturn and much more. But to your earlier point, oral health is literally the foundation of a lot of other health concerns that, if you don't have healthy teeth and you can't stimulate your gums and jaws and so forth, you tend to have further complications. So to me, this is a prevention, early intervention issue.
Okay. All right, so here's some questions from the chat box. First of all, thanking you for being here. And can you talk a little bit more about Prop 1 and how you see that supporting your priority bills and or your priority areas?
Definitely. Well, Prop 1 doesn't have anything to do with my bills in particular, but what I am the most concerned with is how funds are being shifted. And that's the honest truth. It is being shifted for a lot of the programs that have already been set up and established. So prevention, early intervention type of programming, mental health is incredibly important, and it doesn't have ongoing funding, which is another problem, right? So I think that there's a lot of concerns to be said about Prop 1 and why it was so close, whether it was going to pass or fail. And it's because, again, we need to see results, and we haven't really seen results in a lot of efforts that we've been doing. And I've been disappointed hearing people say that, we shouldn't focus on the homeless or housing or this and that. I think that's actually where a lot of the problem comes from, is that if you do not have stable, affordable housing long term, you can't address the needs in your family, whether it's a mental health crisis, whether it's job security, whether it's your kids staying in the same school district year over year over year over year. So the quality of life without stable, affordable housing diminishes. And so for me, it's not about one particular prop or another. I think everything has their pros and cons. And, we as educated human beings need to kind of identify, okay, what it is, and it's not going to be perfect. We still have to develop more policies around it to improve and continue to improve things.
So here's a question from a healthcare worker. So why is healthcare so far behind in technology?
Okay, so I'm going to say this, and a couple of years ago, the average age of a senator was about 69, 68 years old. They did not use technology. They refused to use technology. Most electeds technically come from the legal field, not necessarily the tech field. And I think that there is a learning curve. And so if you yourself are not exposed to new technologies, you don't necessarily know how to legislate around the issue of technology. And in the Bay Area, I'm just going to say this, I represent Silicon Valley, and I've been pushing. I have a couple of AI bills myself. I just supported a very influential bill regarding AI technologies and much more. And, for me, I have a bill about deep fakes, and in particular, I have a bill that primarily talks about when your image is taken online, whether it's a fake page, whether it's AI, whether it's anything like that, it is identity theft. Right. And we don't talk about it enough. And there are First Amendment issues and constitutional issues where you can't really dictate to platforms what they can do and how they govern and so forth. And I think that's questionable, because when your credit card is stolen, at the back of your credit card, it has a 1-800 number that says you can call and freezes your credit card immediately, because again, it's identity theft. Technology has obviously evolved significantly, and I'm pushing for bills like that again, author initiated, and we need to be able to freeze those accounts that are having deep fakes of us and so forth. So I think there's a lot of work to be done, but again, not everybody has the background experience or usage and personal history with technology.
Yeah, I also think there's some variation between, like, if you're a large corporation like Kaiser Permanente or Sutter, you can afford some of the later technologies. But if you're a small clinic like down in Watsonville serving an underserved population, your ability to afford the latest technology is going to be quite limited. So I think there's a probably variation in what you find across the state. Here's another question. Why don't we use technology for fast delivery of food and medications?
I hate to say this, the honest truth of a lot of the debates in the legislature are based on who lobbies for what, right? People want job security, people want pensions and things like that. And then there are folks that completely could care less about the dignity of a patient and the dignity of workers and much more. So I think with medication, there's a lot of concern in regards to what if there is a mistake? What is the quality assurance? What happens here and there? And I think that it's huge risk, it's people's lives. And so I think that, what does that really look like? And I think that we're going to have more and more conversations like that. So, regardless of, giving medication or fast food was the question, let's take a look at even the truck driving industry, right? We've all heard about autonomous vehicles, and now they're trying to implement it in, transporting goods and so forth. But these are big rigs that are over 6,000 pounds, unmanned. And if they crash, what is the safety mechanism to limit that or stop that or save lives or anything like that? And that's still being vetted in technology spaces. So, as a policy person, do you approve that or not? And so I think there's a lot of conversations, but it all stems to protecting the public, and ensuring that, you know, we don't impede on technology, but also put safeguards around.
Yeah. So another question that came in, would you talk a little bit more about the bill around the caste system?
Definitely. Well, I appreciate the fact that the caste bill question came from an anonymous individual. The caste bill is a very simple bill. It was primarily to protect people from discrimination based on their caste. So it is a discrimination bill, it's a civil rights bill, it's a women's rights bill, it's a workers' rights bill. And I truly believe that all people in the United States, especially in California, should be treated equally. And regardless of a historic system that is banned in many other countries, that it should not have a role here in the United States. And I often say that with representation and much more, our laws have to go deeper and further to protect our growing diverse community. And this is a clear issue in the Bay Area. This has been a clear issue in the college system. This has been a clear issue across the board. And we have a number of cases. For example, the Reddy case in Berkeley. It was a human trafficking ring that was set up, and it was based on, you know, people's caste. And we see this time and time again. And I'm very proud that the legislature understood it, believed it, and supported it fully. And like I said, this is a civil rights bill. And it's a civil rights bill that's not about the normal civil rights histories that we hear in California, that are very much geared towards 1 to 3 different community groups. And like I said, the more diverse we become, the more we have to tackle issues that we've historically never probably talked about.
Okay. Here's another question. So Zocalo Health is an affordable health care for the entire family with a focus designed around the identity and stories of Latinos. Is there any work at your level to support companies like Zocalo Health?
Yeah. You know, I don't want to single out one particular group, but a lot of the community health clinics, especially the ones that provide for our lower income individuals or safety net hospitals and so forth. We have one in Hayward, St. Rose Hospital. I genuinely have been pushing to protect those and ensure that we have loans or grants provided for them. We had hospital grant. St. Rose actually benefited from it. And we have other hospitals that do decently well, like Washington Hospital. And so there's a lot of work to be done to really focus on the community-based organizations and the local smaller healthcare clinics that really are deep in the community. So right now, I will say that there are significant cuts being made to a lot of different things and discussions about future cuts. So not exactly sure where it's going to go.
So here's another question. So as a graduate student in public health, considering moving into the political realm, what considerations would you offer? Or advice, I guess?
Honestly, I think that you should be willing to work really hard in your own profession, but also try to be a part of different organizations, boards, and networking groups. You know, I was a public health commissioner for Alameda County. And when I was a student, I was thinking, you know, I'm the most uneducated individual on this committee. And, you know, I was a student. And people had not only PhDs, but MDs attached to it and much more. And yet sometimes they had such an overlooked a lot of the issues that were about lower income individuals because, you know, they haven't been lower income in a long time themselves, right? And so you always have a voice, but you always have to prioritize the work that you do. That's what's most important. Why are you interested in politics? Who do you want to advocate for? How do you want to go about advocating? So those are the questions that I think you should always ask yourself and have like a North Star of why you're in it.
So do you have a position on AB 2924, the built-in child marriage in California?
Yeah. It's not my bill, it's an assembly bill. It has to come to the Senate before I really analyze it. But child marriage is a real thing that is happening in California. The data there, it's diverse opinions on data, to be completely frank. And some people will say, I had a ending child marriage bill last year, and it was held in appropriations on the assembly side. It was a good bill. It was largely supported and much more. But the understanding of what child marriage is very complicated, again, for an issue that's not super mainstream. And the reality is that people think it's certain communities that practice it. It's not. It's very mainstream. And in fact, there are people that groom children to get away from statutory rape charges. And when they have committed rape, again, it's rape with a child, they end up marrying the child, and the parents want to save face, especially if they're from a conservative community, or the child ends up being pregnant, or much more. So there is a lot of harm to young children getting married and making that life decision that they have no say in, realistically. Again, it's the parent signing away the rights of the child in a lot of ways. And even if the child is there, they are coerced by an elder. And that is the standard across the board. And the fact that we talk so openly about other countries doing this and that and, rights, California is one of 6 states in the nation that does not have an age limit banning child marriages, right? So that's sad to say, considering we're a progressive state.
Yeah, I had no idea.
Yeah.
So it looks like this is the last question here. And this person is willing to help you. What are your thoughts on integrating dental health facilities with mental health support under one roof as part of the treatment?
I would actually be very interested. I am unclear as to, like, in regards to what do you mean by dental health facilities? Do you mean a dentist office? Do you mean like long-term treatment? What are you specifically mentioning? But the problem is we have siloed so many things that the bucket of funds is very specific to one issue area or another. And that's what I see is the debate of, like, okay, how is this going to be funded? Where's the funding going to come from? And much more, rather than how do we solve the problem? And so for me, the transportation consolidation bill is the epitome of, what is happening. There is no clear pattern of how somebody creates a transit agency. A city can create it, a joint powers, a county, a state, you name it, which is way too many options, number one. Number two is that they can be duplicative in service. And for example, we have AC Transit, and the city of Union City that belongs in Alameda County also has a bus system hitting the same routes for the most part. And you're like, okay, how does this save money? How does this benefit the community? How does this do anything? And so they can still pull money from public transportation dollars and federal dollars. And again, it's a problem because it's like, does it really equate to better service to the public? And the larger answer in a very basic way is no, right? We could debate here and there a little bit, but realistically, no. And it's such a waste of money that I want to consolidate and see how. And I think that, when you enter a healthcare facility, you should be able to get treated for dental issues, mental health issues, physical issues, whatever the case may be. So I'm not super stuck on everything being siloed away. But what does that look? How do we envision what, healthcare in one facility looks like?
Okay. Well, before we sign off here, any last thoughts or comments you'd like to make?
I just want to say thank you, Dr. Newhouse. It's been a pleasure. It's always a pleasure to talk to you. I want to thank, Berkeley Public Health as a whole. And my office is always available. We want to help. We take on issues that we truly believe represent the district and represent the Bay Area and California as a whole. And, we're always open to collaborating and learning more from others.
Great. Well, thank you very much. I think you've given us a really interesting and insightful look at our legislature and how it works, and something that, and I've learned some things tonight myself, and I hope the rest of the audience did as well. So again, thank you so much for coming on. I know you're a very busy person. I hope I get a chance to talk to you soon.
Definitely,
Yeah.
definitely, of course. I'll
And
anytime.
say hello to Nurgis for me. And
Yeah.
Risco was a big help. And with
Thank
that,
you.
I want to thank Alice for monitoring the chat box. And with that, I hope everybody has a good evening or day wherever you may be in the world. So, all
Bye,
right.
guys. Thank you.
Goodbye.